Today, we're talking about healthcare.
Nuclear warheads, the weapons of mass destruction, and missiles are on the Lord's band, and pointed at every nation. Time gets shorter. Crates of guns and ammo from country to country. They go.
When Obama was in office, we had 30 million people that didn't have healthcare. 30 million. And I mentioned this on the last video, but, 30 million, 300 million people in the country. He raised the unemployment rate to 10%. He wasn't lying. So I've always been saying this for a long time about unemployment. Unemployment people are the only people that really don't have access to health insurance. Affordable health insurance. Affordable. Let me put that straight. Cobra, now that I'm unemployed, I lost my health insurance in the middle of a pandemic. It's pretty awesome. It's $569 a month for a single. I'm making on unemployment about, I don't know, maybe 27 to 30% of my paycheck. And I was only paying 300 and something when I was working because my employer would pick up half of it. And if you worked for a job that didn't pick up for half of it, find a new job because that guy sucks. By the way. And they're out there. There's plenty of places that do. So, they've been pushing this stuff for years and years and years. And I always tried to tell people who were for it that, even if I gave Obama the total benefit of the doubt, gave him the total benefit of the doubt, that he really tried to make sure everybody was covered under the health insurance. What happens when the next evil Republican gets into office and then turns around and uses it against you? No, you don't think of that stuff because you're just opening that door. But in this country, our president was only around for 4 to 8 years. That's it. And then we elect the next guy. And the way that's been trending for the last umpteen years is we don't like what this Democrat did, so we all vote for the Republican. We don't like what this Republican did, so we then all vote for the Democrat. So the number is still around 30 million. But now we've just added at least 10 million more to the unemployment. So all of those people don't have health insurance now too. So why aren't we fixing that problem? Because that would take care of like 75% of the uninsured. I don't know, maybe make a Medicare Plan B or something for unemployed people. Because that's one thing that always worried me was if I'm on unemployment and I don't go with the COBRA that takes half of my unemployment from me, my unemployment checks, then what happens when I go out for an interview or something, I get in a car accident? I'm screwed. You're screwed. So there should be something there. There should be some kind of, if you're going to give it to the people on welfare, I'm not saying we have to give it full coverage, blah, 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 but at least some kind of catastrophic thing. So if you end up getting injured while you're on unemployment, you're kind of covered. It's a way cheaper solution than giving this national health care thing. Way cheaper solution. Keeps the cost lower for the insurance companies. I think the government needs to get out of the insurance companies at all. I mean, I think I should be able to get my health insurance like I get my car insurance. If there's over 1,000 insurance companies in this country, and in New York, in Syracuse, my boss could choose from maybe 10, 12 of them. We had a choice of 10 or 12, and most of those had so much restrictions on how many people he hires and this, that, and the other thing that, it dwindled it down to maybe 4 or 5. And then out of those 4 or 5, he only had like the choice, a reasonable choice of like 4 or 5 different plans, which he offered all 4 or 5 different plans to us, which most places won't. Most places will say, this is your plan. This is what we offer. This is what you take. This is what you're going to pay. That's it. Take it or leave it. A lot of places don't even offer any health insurance. It's a no-win situation. No-win situation. So my biggest fear right now is with the president. And, you can make an argument about him being a shill and working with the Democrats and all this, tearing up his speech and this, that, and the other thing is all theater, and it's, it's working. It's working well. It's all theater, and he's actually working with them to get all this stuff passed. There's lots of evidence out there for that. But if it's not, they're still using this situation to pigeonhole him into passing this national health care, because now we're in a crisis. You got 10 million more people on unemployment than were before, and they've all lost their health care, especially ones with families. You can't. The family plan for a COBRA is like $1,500, $1,600. It's ridiculous. It's ridiculous. So, that's my fear. That they're going to use this. If we don't get back to work soon, they're going to use this to push this national health care on everybody again. And if it works, well, we're screwed pretty much. Instead of just taking care of the problem. But I don't know. I hope we get back to work soon. That's it.